Hi, I'm Dr. Mike, and on this week's episode of the Wellness Lab, we're going to be talking about sciatica. Alright, so what we're going to be talking about today is sciatica, and first and foremost, what is sciatica? Sciatica is simply just a compression of some of the nerve roots in the lumbar spine. So L1 through L5, all those nerve roots where they come off of the spine, any irritation to any of those joints, discs, ligaments, or nerves is going to contribute to what sciatica would be called. Some common symptoms that come along with sciatica, first and foremost, is going to be lower back pain. Any irritation of those joints is going to cause some irritation of the ligament structures and the nerves in the lower back, contribute some pain there. We're also, a lot of times, we're going to see leg pain, we're going to see knee pain, we're going to see hip pain. Anytime we're talking about pain or like a numbness or like a tingly kind of sensation, that's all nerve related. If this goes on for long enough or over long enough periods of time, we can actually start to see muscle atrophy, so muscles actually wasting away one side of the body versus the other. A lot of times people come in with a complaint of like a leg giving out. They're taking a step, all of a sudden their knee or their leg gives out. Once again, coming back, that's a neurologic type of issue or problem. Some common misconceptions that we tend to see off of this is that a lot of people think that sciatica is a strictly diagnosis. Sciatica is more or less a symptom of something else going on. Another one that we see is people come in, they have leg pain, they have pain in their calf or pain in their foot, but they don't have any lower back pain. They assume that that's something different than what sciatica is. Sciatica can exist with simply just a lower back pain, can be a lower back and a leg pain, or vice versa, leg pain with no lower back pain. A lot of times, old adage was, if you have you throw your back out or you have these lower back or leg issues, your best bet is to lay in bed and do nothing. That's actually one of the worst things that you can do, and typically ends up extending that course of care, or that time that you need care, and it makes your symptoms a whole lot worse. Being active in very mild monitoring or monitor fashion is going to be probably the best thing for you, just to get up and be moving, but within a very safe environment, obviously not doing anything to aggravate either the lower back or the leg. Last misconception we hear a lot is a lot of people come in and they think that surgery is their only option. They've been told that they have a disc bulge or a disc herniation, and they come in thinking that surgery is really the only thing that they can do. Absolutely 100% incorrect, not even close to being true on that. Some common causes of what we tend to see in terms of sciatic-like pains. One is just going to be simple spinal subluxation. The vertebrae moves out of position, irritates the disc, irritates the nerve, can contribute to that radiating type pain. Another one's going to be a disc bulge. So a disc bulge and a disc herniation are just varying degrees of irritation or insult to that disc, whether it's from injury, chronic repetitive stress, whatever the case may be. That disc bulge herniation can definitely contribute to sciatic-like symptoms or pain. Another is going to be degenerative disc disease or degenerative joint disease. Arthritis built into those joints can irritate the discs, once again, makes those things a bit more prone to having these problems. Last thing is spinal stenosis, so that's in a more advanced form of degenerative disc or degenerative joint disease. That stenosis basically gives less and less room for that nerve to pass on through, so it takes less of an insult or less of an irritation to cause issues or cause problems within those areas. Coming up next is going to be Rainey's Fitbit.
Hi, I'm Rainey. Welcome to this week's Fitbit. This week we're talking about sciatic pain. So I'm going to show you some stretches that you can do to kind of alleviate that pain. So why are we doing stretches for this? So if the muscle is too tight, it can cause pressure on the sciatic nerve, which is going to cause that pain or those symptoms of sciatica that you may feel. So first we're going to start with two stretches, a hamstring stretch and a stretch for your piriformis, which is here in your hips and your glute, kind of down here by your butt. So that's the reason that we're stretching those muscles, is to kind of loosen them up so that they're not putting the pressure on the nerve, right? So first we're going to start with the hamstrings. So in here, I don't like to do a toe touch stretch for the hamstrings because it kind of puts some pressure on the low back. especially if you have low back problems. So what we use in here is just like a stretching strap like this. If you have a towel or like a jump rope or anything that's kind of firm that you can use at home would be fine. So what we do is put right under your foot like so. I'm gonna lay back and then I'm gonna pull my leg towards me gently. So I'm gonna feel that stretch right back here on the back side of my leg. This leg that I'm not using should also be straight on the ground like that. Having it bent, which is what most people feel comfortable with, actually does take away from the stretch that you feel. You can also kind of cheat and lift your hips, which we don't want to do that. So keep both legs as straight as you can. You're going to hold it up there for about 15 or 20 seconds, and then we're going to switch sides. And then do the other side. So you'd want to do this a couple times on each side just to really get that muscle loosened up. Next is this piriformis stretch that I was talking about. So what you're going to do for this one is laying on your back with your knees bent. You're just going to cross one leg over, and then we're going to lift that foot up and kind of pull it towards us. So this leg is pulling this leg towards me, and I'm feeling the stretch down here in my hip, so down in my piriformis through here. This does require a little bit of core strength to kind of lift everything together. So if that's difficult, what you can do is just kind of pull that leg with your arms. Just make sure you're pulling from down here and up at your knee so it's coming at the right angle, just like that. Again, hold it there for 15 or 20 seconds, and then we'll switch sides and do it on the other side like that. Again, do it a couple times on each side. Only stretching it out once is never enough. So, do it 2 or more times as long as you have the extra time, I guess. However long you have, do it as much as you can. All right, so now another way to help with the piriformis, we're gonna do something with this lacrosse ball. If you have a tennis ball at home, it would kind of work the same way. What you're gonna do is sit on the ball. So put the lacrosse ball at the piriformis, and you're gonna kind of lift your hips up and roll it around through there. So what the ball is doing is kind of similar to like a massage. It's pushing through the tight muscle and trying to loosen it up. It is going to be painful. It's not a comfortable feeling, especially if it's very tight. So just be aware of that. Just do it for 30 seconds or so. Maybe switch to the other side. And yeah, so that's all for that one. All right, and then the last stretch here, I call this hip crossovers. So you're gonna be down on your back again with your knees bent like this, but we're gonna keep our knees and our feet together. So just hands out to the side or wherever is comfortable. Just kind of take your knees off to the side. Your shoulders stay down so that you're kind of twisting through your trunk area, and you're gonna feel a stretch down your side and in your low back. So you're just gonna go side to side, like so. And what's happening is you're getting a little bit of mobility through your SI joint. And your SI joint is where your sacrum and your ilium are meeting together. So kind of like right at the tailbone, I guess. If that becomes inflamed, it can also put pressure on that sciatic nerve because the sciatic nerve is running through that joint. So that's a good one to kind of like loosen that up and get some mobility in that area too. But yeah, so all of these stretches that I showed you, you can do them every single day as long as you're having that sciatic pain. And as I mentioned, holding the stretches for 15 or 20 seconds, and then just make sure that you're doing them more than once, especially with those hip crossovers, just kind of going side to side until you've done about 15, 20 of them, and really get those muscles loosened up. All right, so that's been this week's Fitbit, and we'll see you next time.
All right, so what we're going to be going over today are some different treatment options of ways that we can help with sciatica. So the first and foremost with anything here in the office is the adjustment itself. Realigning the bones of the spine, helping get better motion, proper motion back into those vertebrae, reducing inflammation and swelling off of that. Another good option you can employ would just be some simple exercises and stretches. And last one is going to be some basically decompression. So what we have Rainy here set up on the table is our spinal decompression or traction table. And so as I go on this, what it's going to be doing, it's hooked up around the top of her hips, and what's going to be doing is stretching in a downward fashion. It's going to pull down to a certain point, hold it at that point and then relax it back out. It's always gonna have a little bit of tension, a little bit of pull onto her. She's not really gonna feel much simply because the table is gonna be moving underneath her. What we use this for primarily is lower back type disc issues, disc herniations, disc bulges, or sciatic-like or radiating pains. When we have that irritation, the inflammation within the discs themselves, that pumping motion that we're employing with the table itself is what's gonna help to flush out a lot of that inflammation, that swelling that's at those discs or those nerve roots. It's gonna help pull pressure off of whatever that nerve is that's irritated or ticked off in the lower back.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.